You can say this robot is lending a hand or a whole arm to helping breast cancer patients. It's called the Image-Guided Automated Robot, or IGAR for short. It fits right into an MRI machine and allows for biopsies to be performed with 10 times the accuracy of a human.
With our system, the radiologists, as soon as they detect a lesion, they can inform the system what is the lesion they're interested in, and the robot does the rest. In an automated fashion, will freeze the skin down to the lesion and go and biopsy.
If this robot seems out of this world, well, that's because it is. The technology comes from Canadarm, which paved the way for Canadarm2 and Dexter, both of which were responsible for the successful assembly and operation of the International Space Station.
Canadarm2, it has to pick up astronauts, it has to move them around in space, it has to install elements, or it had to install elements that weighed thousands and thousands of kilos, that were the size of a city bus. And so failure was not an option.
Taking the technology of Canadarm, the Canadian Space Agency joined forces with the Centre for Surgical Innovation and Invention to create the robot. One of the first of its kind to be put inside an MRI machine. It can show the size and location of a tumor more accurately than a mammogram or ultrasound.
If doctors can see tumors and lesions in an MRI machine, and we can actually put the robot in there, and they can do the operation or the surgery or the biopsy or whatever they might be without having to remove the patient from the MRI machine.
Right now, the robot, which is being used in clinical studies, is not yet capable of operations, but doctors are hoping that that will be the future of IGAR, a one-stop shop for breast cancer patients.
Systems currently being tested, which allows very quick diagnosis of the sample taken within 20 minutes. I think once that achieved, the system is then capable, if they detect something which is suspicious, to go in at the same setting and ablate the lesion completely. So the patient basically comes in for a screening, ends up leaving having a lesion not only biopsied but treated.
This IGAR is the first of its kind, fits in an MRI machine, and is designed specifically for detecting breast cancer. But doctors say in the future, not only will this robot detect breast cancer, but other cancers like lung and liver. And they're hoping not only to detect the cancerous cells early, but also to treat them right here on the spot. Doctors are hoping this little robot will have a very big impact on the future of cancer treatment.
And systems like IGAR are capable of seeing the images and treating the lesions very early on and achieving, my hope is that one day we will see 100% cure rate from cancers.
From making a difference out of this world to making a difference that could change the world. I'm Mia Gordon, and this has been a Sun News Special Report.